I got into DBT because I was seeing a client in graduate school who I sort of didn't understand that she had borderline personality disorder because she wasn't doing a lot of suicidal behavior or self-injury, but she had a lot of the interpersonal and emotion dysregulation difficulties. And my supervisor at the time said to me, "There's a treatment out there and I think you need to go learn it." And I loved it.
I was thinking of working with patients with borderline personality disorder and substance use disorder. I had very little knowledge of what's DBT, but actually when I was just getting around searching for things that really work, DBT just came up as the gold standard.
I just had encountered suicidal attempts in my patients. I realized that there were totally no places to refer these patients to. So me and some of my colleagues, we started to look around in search for some training, and we found the Behavioral Tech Organization and Linehan Institute.
The thing that DBT offered, and I guess got me really interested, is a different way of thinking about the transaction between me and the client. And then not just thinking about it, but actually finding a way to change behavior and get new stuff to show up. You actually make a difference. And that's ultimately what DBT offered that I hadn't found previously.
I went down to do my child and adolescent psychiatry training in New York. I believe the first adolescent outpatient DBT program in the world had just been established there. I happened to stumble into it, and I went and I just kind of sat in on the team at first and heard that they were working with some really difficult kids in the Bronx who'd been through just horrible, terrible things, and were kids who I typically in the training I had had until that time I would have thought would take at least months, if not years of work. And in 12 weeks, they had data showing they were affecting significant change in the kids, which I was like, how does this happen?
Actually having things that I could teach my clients right out of the gate that they could leave the session that day and do. That they could come back the next week and say, I tried that, it worked, it helped. For me, therapy at that point, I was such a baby therapist, that was so reinforcing because I was like, okay, I did something helpful.